Hi, folks. This is Autism with Dr. Andy, and today's guest, Steve Kossor, is the director of the Institute for Behavior Change. I met Steve out in Chicago at the Autism One conference, and ladies and gentlemen, I suggest that you get a pen or pencil and piece of paper because Steve is full of wonderful information that you're going to want to know about for either yourself, friends, or family. So welcome, Steve.
Thanks so much for having me on, Andy.
My pleasure. So, Steve, tell us about you and what you do.
Yeah, I'm a licensed psychologist and a certified school psychologist in Pennsylvania. I was licensed back in 1981, and I formed the Institute for Behavior Change in 1996. So I had a bunch of years of experience as a psychologist, straightening my tie, listening to kids lie to me about what's going on in their lives while their parents sat in a waiting room wringing their hands and writing a check. And I made my living like most other psychologists do. And then I found out about the Medicaid system and the fact that the EPSDT mandate, I'll explain that further, but makes it possible for kids to get treatment in their homes and schools by staff under my supervision, and I started doing that in '96, and now I have the largest psychology practice in the state of Pennsylvania that is exclusively devoted to treating children, and they're funded almost 100% by Medicaid.
Wow, this is super, and especially I did not know that you had the largest practice in Pennsylvania. That is impressive.
Well, it's not the largest practice. There are bigger practices, but we're the only one in Pennsylvania at this size that focuses exclusively on treating children, and almost all of our funding comes from Medicaid. See, Pennsylvania is one of 33 states in the nation in which a child with a disability can enroll in Medicaid and get treatment funding at no cost to their parents whatsoever, regardless of the family's income. So we treat children whose parents are wealthy, frankly, and we treat children whose parents are extremely poor, and all of the kids, almost three-quarters, or if not more, are getting better in as little as 4 months. They're not cured, but they're starting to turn the corner and heading in a positive direction in as little as 4 months, and the federal Medicaid statute allows them to continue receiving treatment funding for birth through the age of 20. In other words, the day they turn 21, the funding has to stop. But there's a lot of good you can get done in that time period. Almost 90% of our children are finished with treatment within 3 years, and we're talking about 25, 30, or more hours of treatment every week, Monday through Friday, or sometimes even on weekends, in the home, in the school, in the community, by people under my supervision and scope of practice. It's a terrific model, and I call it the greatest treatment funding secret ever concealed.
Tell me the name of your model again.
It's founded under EPSDT, Early and Periodic Screening, Diagnosis, and Treatment. It's a little-known part of the Medicaid Act. And what I call my model is effective treatment in a wraparound cup. What I'm doing is tapping Medicaid resources through the EPSDT mandate, which is a federal mandate in all 50 states that goes back to 1989, so that any child with a disability who is enrolled in Medicaid can access EPSDT funding for their treatment program, and that includes mental health treatment. I send my staff to the home and school and into the community with the child. They literally stand next to the child and act a little bit like a buffer against the more pestilential influences surrounding them in school. I mean, it's no secret that kids with disabilities are very often taunted horrifically by their peers. My staff provide a barrier of safety for the kids, as well as showing the kids how to interact more successfully with their world. and 3/4 or more of the kids we work with within as little as 4 months have started making significant improvements in their behavior. We work with them from the age of birth through the age of 20. At the age of 21, services have to stop. But the bottom line is 90% of the kids we treat are finished with treatment within 3 years, and they're not doing self-injurious things anymore. They're not ignoring the adults who tell them how to grow up correctly. They're not engaging in physical aggression. Their communication skills have improved significantly, and their socialization skills have also improved significantly. All of this is accomplished through Medicaid funding through the EPSDT program, which is a federal mandate in all 50 states. Any kid enrolled in Medicaid is entitled to access to EPSDT funding for the treatment of their condition, including mental illnesses, and that would include autism spectrum disorders, ADHD, and a whole host of other conditions. So the funding's out there. It costs parents absolutely nothing, and that is regardless of their family income in 33 states. In all 50 states, if you have an income at the family level that's below the federal poverty level, every member of the family can enroll in Medicaid, and the disabled children in the family who are under the age of 21 can have funding for their mental health treatment 20, 30, or more hours a week, every week, year-round, in their home, in their school, and in their community. It is the greatest treatment funding secret ever concealed.
Wow, this is impressive, Steve. And folks, I want to make sure that you have access to Steve's program and information if you're not in Pennsylvania. So in just a moment, we're going to give you Steve's contact information. But let me continue on and ask a question. Steve, you mentioned that within about 4 months, most kids get markedly better. Is that correct?
That is correct, and that is the results reported to me by 4 independent researchers at 4 separate colleges between 2007 and 2014. That would be the University of North Carolina at Chapel Hill, Thomas Jefferson University in Philadelphia, Villanova University outside of Philadelphia, and Immaculata University in the suburbs outside Philadelphia. So these researchers from 4 different locations at 4 different times each looked at the treatment outcome data we have been collecting for more than a decade. And they said, my God, this is unbelievable. These kids are almost all getting better in 4 months. And if they stay in the treatment program for a year, they're getting even better. So it's not like the gains are in the beginning and then trail off. They continue to mount. They add to each other. It's kind of like a geometric progression. The better you get, the more you're able to learn, et cetera, and it just continues. But at some point you have to say we have done as much as we should be doing with Medicaid as a funding stream, and the way I define what we should be doing is preventing the child from being a victim of perpetrators of abuse so that they can actually use their voice and make complaints about bad things that happen to them. We want to have them able to listen to their caretakers and take benefit from the advice and direction they give. We want to stop them from using physical aggression as a means of venting frustration or communicating. We want to improve their ability to socialize. And perhaps more important than anything, we want them to be safe in the environment. They need to understand vehicular traffic and the danger that poses, the dangers of talking with strangers, et cetera, et cetera. All of these things can be addressed through EPSDT funding, and I've been doing this in Pennsylvania for almost 20 years.
Wow. Steve, this is impressive, and let's give our listeners your contact information.
The easiest way to connect with me and anyone else at the Institute for Behavior Change and all of our resources is to just go to the Institute website, and that is www.ibc, that is Institute Behavior Change, and then a hyphen like a minus sign, and then PA like Pennsylvania.org. So it's ibc-pa.org. And you'll see links to my personal blog at the bottom of the home page. You'll see all kinds of information about EPSDT, the laws that are created governing it, and just everything that you could possibly imagine to empower a parent, a lawyer, an advocate, or anyone else, a professional who would like to do what I've been doing successfully for 20 years.
Well, this is super, and I know you and I had talked about you're getting together a book, and I think what you're doing is so amazing. I hope you do get that book together because people need to know about it, and obviously you have something very unique, and we'd like to share that with the whole country.
Well, there is one resource that people can go to if they'd like to see actual examples of treatment plans that worked that I and my staff created between 2007 and 2012. These were all funded by EPSDT, so they all represent evidence of treatment programs that worked. The website to access that is treatmentplans.worked.ed.com. So that, people can go there. There are almost 600 treatment plans there with the evidence that shows that they were effective. So those plans can be downloaded by professionals, parents, advocates, anywhere in the world, and used as the foundation to deliver behavioral treatment that will probably be effective there, just as it was in Pennsylvania.
So, Steve, folks who want to access these individual plans can go to the website you mentioned. And would you say that website again and slowly, because people will want to write it down?
www.treatment, and this is all one word, no spaces, treatment plans, P-L-A-N-S, that, T-H-A-T, worked, W-O-R-K-E-D.com. There is a link to treatment plans that worked on the IBC website. So really, if people would go there and just explore, there's no end of good stuff that they can access.
Well, this is wonderful because this behavioral treatment plan could also be part of an individual educational plan. It's the behavioral component.
Right. In a school, it would be called a behavior support plan. And we've got, I don't know how many schools over the years have just taken our behavioral treatment plans and incorporated them directly into children's IEPs. The big advantage of using these plans, though, is that they have been tried and found successful. In addition to the plans themselves, there's all kinds of recommendations of how to monitor progress so that you can continue to obtain funding from insurance companies for the treatment. There's so many things that most people, unfortunately, most practitioners, don't know or don't tell their patients. It's almost as if they flap into the room, disgorge their priceless advice, and flap out, leaving very little behind except the bill. That's really the most outrageous part about this. Nobody is telling parents how to get funding for their child's treatment program. Instead, parents are taking out second and third mortgages to buy a few years of treatment when all they really have to do in 33 states is apply for medical assistance or Medicaid enrollment for their disabled child and then get a treatment plan that has been vetted, like the 576 that I've created, and write that kind of a treatment plan, prescribing treatment for the child exactly as I would if I lived in that state. And they take that treatment plan to the state Medicaid agency and say, here you go, I'd like this funded just like it was funded in Pennsylvania. If the state denies funding, saying something like, we don't do that here, they've just violated the child's civil rights, because children have a civil right under the Social Security Act to funding under the EPSDT program, which is part of the Social Security Act, they're entitled to that funding as a civil right. It's part of the 14th Amendment's protection for equal access under the law. I mean, this is stuff that most lawyers have no idea about. Even constitutional lawyers haven't studied it because it addresses disability rather than the more traditional civil rights about race or other kinds of things. This is civil rights related to disability. And I think I'm probably one of the few scholars or authorities in the country that can talk intelligently about this.
Steve, this is wonderful. And folks, I want to mention to you that when I met Steve in Chicago at the Autism One conference, and he started to tell me about this, I invited him to lunch. We had a couple of lunches together, and I thought this might be one of the most important shows we ever do, because throughout the country we'll be able to provide access for children who need it for behavioral services through Medicaid. And did I get that right, Steve? Is that Medicaid or
that's exactly what we talked about. The problem that the audience has to understand is that a benefit like this is the greatest treatment funding secret ever concealed. A benefit like this is going to take a little doing to pry out of the hands of the state authorities. But I've done that. I filed a civil rights complaint against the state of Pennsylvania and all of the insurance companies here, claiming that the kids' civil rights in this state were being violated. Now, don't forget, Pennsylvania's got a reputation for being one of the most liberal states in the nation insofar as Medicaid funding for children's mental health treatment is concerned. I hear frequently that people say, boy, I wish I lived in Pennsylvania. Well, you can go to the IBC website and find the list of all the 33 states that do the exact same thing about allowing kids to enroll in Medicaid regardless of family income. If you live in one of those states, you just have to apply for medical assistance benefits for your child, get that determination, and then I can, as a consultant of some sort, help the parent and any licensed professionals in that state to write a treatment plan and a proposal for treatment for the child, and I can even help them set up the organization necessary to begin providing those services. And I don't do this to make money necessarily. It'd be nice to have a little extra income, but I'm trying to leave something worthwhile behind in what amounts to a vast wasteland of professionals who have no care whatsoever for what it takes to implement their brilliant ideas. Kurt Cobain called it priceless advice, They dispense it, but they leave parents with no idea how to make it real, how to put it into practice. And that's what I can show.
Well, this is fabulous. And Steve, this must have taken an awful lot of thought and action and perseverance to make this happen, because to do something this complicated, I'm sure, took a lot of time and effort, and I applaud you for it, because you obviously are a person who keeps at it and doesn't give up.
Kids are entitled to this funding as a civil right. It's morally and legally reprehensible that right is being denied them by state and other county and government officials, and I mean to do something important to stop that process.
Folks, we have to take a short commercial break. We'll be right back with Steve Kossor, who is the director of the Institute for Behavior Change in Pennsylvania, and when we come back, we're going to talk about exactly what he does and who he works with in his institute. We will be right back. Hi, folks. This is Autism with Dr. Andy, and today's guest, Steve Kossor, is the director for the Institute for Behavior Change in Pennsylvania. He has developed a fascinating program for treating youngsters who have behavioral issues and doing it by using Medicaid funds. Welcome back, Steve.
Thanks again for having me on, Andy.
Steve, I'm very interested in actually the process. So we know that in about 4 months we see marked changes, significant changes. And I'd like to know what happens in those 4 months that brings about these changes, and also, are you working mostly with kids on the spectrum?
Well, the first answer is that we are, in fact, working mostly with kids with autism. About 55% of the children we've treated for the last 20 years have had an autism spectrum diagnosis. About 30% have ADHD in any of its several varieties, and about 10% have other conditions, conduct disorders, etc. So any child with a mental illness diagnosis, that would be autism spectrum, ADHD, or anything else that's in DSM, the Diagnostic and Statistical Manual of Mental Disorders, the 5th edition is the latest one. If the condition's in there and it exists in a child, then we can treat that child, bill Medicaid through the EPSDT mandate, and get paid. But let me describe what we actually do. We have master's level mental health professionals, people with substantial experience, usually several years, working in the field with children, and they come to work for the Institute under the direct supervision of licensed psychologists. I'm providing myself supervision to these people between 1 and 4 hours every week to make sure that their skills stay sharp, get sharp, in their delivery of mental health behavior support services to children. That includes writing treatment plans, monitoring them, making sure we collect the outcome data that supports the fact that the kid is getting better. And if the child's not doing as well as we had hoped, we fix the treatment plan. We can fix it every week because we're taking outcome data every single week. That's why so many of our children are getting better, because we don't write a plan on Monday and then 8 Mondays later look at it. I mean, that's the typical standard, unfortunately. So you take outcome data every single week by master's level mental health professionals, and then we also have what we call therapeutic staff support providers, TSS. These are people with bachelor's degrees in psychology, education, closely related fields like that. So they have at least some experience and training in the world of treating children. And they work under the direct supervision of the master's level people who are seeing them every single week for 30 minutes in supervision if they work less than 20 hours, or 60 minutes every week if they're delivering more than 20 hours of treatment to the child every week. Now, don't forget, the National Academy of Sciences and the American Academy of Pediatrics have both said many times that the minimum level of treatment necessary for a child who's displaying autism symptoms is 25 hours of intensive individual treatment every week. That is the minimum. So my staff are doing that. They'll go into the school from 8 to 2, Monday through Friday. That would be about 30 hours. And they're with the child sometimes on the weekend or in the evening as well. Now, that's certainly not common, but it is possible under the EPSDT mandate if it is necessary. And all you have to do is have a competent, courageous professional in the state prescribing the truth about what is necessary and effectively selling it to an insurance company. When you're a prescriber like I am and you know the law encyclopedically, it's not hard to write a prescription that meets all of the standards and then has to be funded, lest the child's civil rights be violated by an insurance company. So you see, this is not a go-along, get-along kind of a scenario. It's having knowledgeable professionals lined up with the family and the child, working closely together to achieve all of the civil rights that children are entitled to and deliver a treatment program that actually works.
Well, super. And tell us about your staff training. What do you do with your folks to make sure that they are knowledgeable enough to work successfully with these kids?
Well, let's take the bachelor's level people first. In order to be eligible for employment in our company, they have to have received a bachelor's degree in psychology or education. And that's pretty much it. More than half of our bachelor's level people are enrolled in master's level programs. They're going to be psychologists, social workers, counselors, therapists of one sort or another in their eventual professional career. But in the meantime, they need supervised training and experience, and we provide it. We actually pay them $16 an hour and offer health insurance to them as well, as a means of giving them a real job fresh out of college, working with children who desperately need their help. So it's a terrific draw. We get hundreds of people wanting to work for the Institute, even from other states wanting to relocate here. So they get that background of training before they show up. When they get here, they have to pass a 12-hour training program. They have to stay awake. They have to write intelligent notes reflective of the fact that they've been trained. You know, and we don't just take anybody because they're breathing. They have to actually meet our very high standards before we even offer them a job. After they begin working with us, they have to complete 24 additional hours of training in their first 6 months, and then they have to take 20 hours of additional training every year thereafter. And the best part is we expect our master's level people to take the same training. After all, they're going to supervise these people. How could they possibly not receive the same training? But I'm learning more and more that we're the only outfit that actually does that, unfortunately. So the Institute for Behavior Change is a training facility for new professionals. We recruit, train, deploy, monitor, and reward new practitioners of mental health treatment who want to help children.
Very good, very good. So, Steve, what I'm hearing is that your folks are properly background out in terms of they're vetted, they you know who they are, they are responsible people who are highly recommended by folks in the field. Then they're given the training by you, and they have to pass a 12-hour training program. And then because you're in Pennsylvania, and I'm assuming that you're throughout the whole state, is that correct?
No, actually, we only exist in the lower right-hand corner of Pennsylvania, the southeastern region near Philadelphia. That's exactly what I'm hoping for, that the word will get out that this is not just a nice idea. It's possible. I've done it. I've done it for 20 years without any significant challenge that I couldn't meet. Now, don't forget, I didn't say without any significant challenge. I get challenged all the time. But the people who challenge what I'm proposing, most of them have never read the law. Most of them are listening to people who also didn't read the law. You know, they don't understand how the system is supposed to work, so they go along, get along, and do the best they can with what they've got. And, you know, we're in the midst of an audit right now, and the auditors and I are talking, and they're frankly saying, nobody does what you're doing.
Wow.
You know, we're not expecting to get a big claw back from you. You don't make mistakes like a lot of the other providers do. And we know that when there are little errors along the way, you're fixing them before we even leave. So
Steve, we have to I'm sorry to interrupt, but we have to take a short commercial break. We'll be back in just a minute. And folks, when Steve comes back, Steve Kossor, the director of the Institute for Behavior Change, if you are interested, have a pen or pencil ready and a piece of paper, because we're going to give you the contact information. We'll be right back. Hi, folks. This is Autism with Dr. Andy. Today's guest, Steve Kossor, is the director of the Institute for Behavior Change in Pennsylvania, and he's doing some absolutely fascinating and commendable work, working with children who have behavioral challenges. Welcome back, Steve.
Thanks so much, Andy.
So, Steve, tell us how to get in touch with you.
Well, the easiest way is to send me email, and you can get my email address and contact through the IBC website. But my email address, if you want to write it down, is S as in Steve, A as in Apple, my last name, and that is Kossor, S as in Sam, O-R, at ibc-pa.org.
Excellent. And Steve, would you also give them the information for your institute?
Sure. The Institute for Behavior Change website is www.ibc, that is Indigo Baker Charlie, hyphen like a minus sign, PA like Pennsylvania, .org, O-R-G.
Great. Now, as I'm listening to what you're doing and enjoying it very much, Steve, I know that something this important and this comprehensive doesn't happen without lots of challenges. So share with us some of the challenges you've had to overcome to make this happen.
Well, the challenges are relentless because every state government is trying to make sure that Medicaid funds flow only into schools. And schools are swallowing enormous amounts, hundreds of millions of Medicaid dollars, over $50 billion in the U.S. in the last decade alone. So the states are all very much supportive of schools using Medicaid money. But Medicaid is a keg with two taps. There's the school tap coming out the back that flows unrestrictedly into schools, and then there's this little spigot that comes out the top. And parents who understand the rules, like I'm explaining, they can tap that little spigot and use Medicaid to fund their child's treatment in their home and school in ways that people just don't know exist. So here's the challenge. When you go to the state government and you say, here, I want to fund this program under our state's Medicaid plan, well, the first thing they're going to say is, no, we don't do that, because you have to be careful. You have to go to the EPSDT unit within the state, because only EPSDT has this funding available. It's not general Medicaid. So you go to the EPSDT window and you say, I want this funded just like it was in Pennsylvania. Here's a treatment plan. Here's all the bells and whistles. And chances are they're going to say, no, we don't do that here. They won't tell you, no, we can't do that here. They're going to say, we don't. And at that point, a licensed professional can step up to the window and say, well, actually, I do. I have staff, here are their credentials, here's our business model, and I can supply all of that. I can show them all how to do that. And at that point, it's just a simple matter of the parent getting the signature of the state official on the treatment authorization form. And now it's funded in that state by Medicaid.
Wow. Very, very nice. And but I'm assuming that a lot of parents, once they're told we don't do that, they just give up.
Of course they do, because they think they're talking to people who are being honest with them. That's the worst part about this. We elect people to high office under the assumption that they're being honest. And their employees, the bureaucrats, are hired, and unfortunately it seems, to conceal access to treatment funding. It's disgusting, but you can't deny that it's happening. So that's where the Office for Civil Rights comes in. If a family is denied access to EPSDT funding, their next move is to file a civil rights complaint against the state for denying their kids civil rights. And the best part about that is that does not require any legal input whatsoever. I wrote one myself, and I'd be happy to give people some guidance as a case manager in that process. The best part is that once a civil rights complaint is filed, it lowers a bell of protection over the family who filed it. The Civil Rights Act of 1964 says you're not allowed to exact reprisals against people who file civil rights complaints. There's a Division of Civil Rights within the Health and Human Services Office that handles civil rights complaints related to disability. It's not just a race thing. Kids with disabilities have civil rights too. So if the family files a complaint, this is a way to wake up the state that this is not going to go away, and they damn well better fund the treatment that's proposed, because the treatment meets every conceivable standard of excellence. It's going to be monitored by a licensed professional. It's going to be implemented by highly trained and supervised staff. It's using a treatment plan that meets every imaginable standard of quality, and you're going to take outcome data every week from the parent to prove that the kid is in fact getting better in response to the treatment plan, or the treatment plan will be fixed so that happens.
Steve, I want to make sure that our listeners have this down pat, and so let's go over it again. When you start out and you call the state, would that be the State Board of Education?
No. You want to enroll your child in the Medicaid program in your state. First of all, if the kid cannot enroll in Medicaid because the family income is too high, that's a deal breaker. But in 33 states, family income isn't counted. So first of all, you can go to the IBC website and download the list of states in which there is no limit to family income. And that's in the Resources for Parents tab. It's the last document in that list. So if you're on that list, regardless of income, you go to the state Medicaid agency and say, I want to enroll my child. You do what you have to do, file the papers, and you get an MA card for the child. Then you have a licensed professional in your state write a treatment plan following an evaluation of the child that has the same characteristics that my treatment plans have. The professional hands that report to the parent takes it to the state Medicaid agency and goes to the room where they keep the EPSDT money. They don't waste their time with the Bureau of Developmental whatnot in the office for we don't pay for nothing. They don't waste their time. They go for EPSDT funding, and I can help guide people throughout that process.
Steve, if you just hold your thought, please, because we have to take a short commercial break, so we're going to just a quick recap. The first thing we want to do is enroll the child in Medicaid. Then we want to have a licensed practitioner develop the treatment plan. And folks, when we come back, we're going to continue on with the progression as to exactly what to do. We'll be right back. Hi, folks. This is Autism with Dr. Andy. Today's guest, Steve Kossor, Director of the Institute for Behavior Change, is doing some fascinating things with Medicaid funding for the treatment of children with behavior challenges. And where we left off, he had given us the process for how to get the help your child might need. And we started off by first saying, first you have to apply to the state for Medicaid enrollment. Second, you have a licensed professional develop a treatment plan. And let's continue on, Steve, with where we are next.
The next step is to find a licensed professional who can deliver the program. And it's not hard to do that. All you have to do is introduce that licensed professional to me. I can show them how to create as a sideline a business that will provide these services exactly as I'm doing in Pennsylvania. And in fact, we, with our staff at the Institute, could provide a lot of the quality assurance and intellectual expertise necessary to run the program in anywhere in the world. So we can use telepsychology, which is fully authorized and approved by Medicaid, to render services all over the U.S., and we can certainly help in other countries as well. So you get a licensed professional in the state where the child resides to enroll in Medicaid, and then do whatever the little hoops they have to jump through in order to be able to bill Medicaid. We can help them with the billing process. We can help them set up the treatment program exactly like we do it at the Institute. A lot of the materials are available in the public domain anyway. I can be a consultant as a case manager anywhere in the world. I'm not practicing psychology, although I am licensed in Pennsylvania. So the bottom line is we can help professionals who would like to do this as an adjunct to their existing practices and then grow it over time. In 20 years, I created the largest psychology practice in Pennsylvania that deals exclusively with children in exactly this way. Obviously, having 20 years of experience doing it, I can help somebody in another state do this in a matter of months. But there are going to be challenges. There are going to be people who say, no, it can't be done, but that's where the Office for Civil Rights becomes so important. They make a couple of phone calls, and to avoid serious repercussions in the Medicaid system in the state, with a couple of phone calls, things start miraculously changing. They swept the entire plan to revamp the behavioral health system in Medicaid off the table within 2 weeks after I filed my civil rights complaint in 2012. It put them on notice that they can't perpetrate these abusive practices. They're going to have to mind their P's and Q's. And the best part is that there was a bell of protection that lowered over me because I filed a civil rights complaint. That's not a joke. That's not a superficial or inconsequential event. It makes them take notice, and I think if professionals in the field would be a little bit more courageous, they can take a page out of my book. I've been doing business as usual for more than 2 years since I filed that complaint. And believe me, it's had a terrific benefit in the lives of every kid in Pennsylvania because the plans they had afoot for cutting back services are gone. They'll still try to put them in somehow, some way, but the CMS, the Centers for Medicare and Medicaid Services, which I communicate with regularly, has just promoted some new regulations to further tie the hands of managed care in Medicaid. It's wonderful. Now, there's some other things in those proposed rules that are frightening that have to be fixed, but it's a matter of dialogue, and people can go to my blog and see all of the most up-to-date information that I'm distributing. And the easiest way to get to my blog is use my name, Stephen, S-T-E-V-E-N, Kossor, last name K-O-S-S-O-R, .wordpress, that's a common blog site, .com. So StephenKossor.wordpress.com is my blog. If you Google my last name, you're going to see all kinds of videos on YouTube, things that I've promoted and tried to produce to explain the EPSDT benefit. The most important one is at the top of the IBC website. It's a link that says, click here to find out what we do. It's a program I presented at the National Federation of Families meeting in Washington just last November. So there's no end of resources. There's no end of my willingness to help. And if people will just take up the banner that I'm waving here, an awful lot of good can be done in an awful lot of places, not just the U.S., but anywhere in the world, because the model that I created is called a force multiplier model. I'm a single psychologist. I have 30 or more people working under my scope of practice, and they're all doing good, and each psychologist could theoretically help 50 or more people every year through this model funded by Medicaid in the U.S.
Steve, I just want to make sure we get this in before we close out. So first in the steps, we have the family apply for Medicaid for their child. Then we have a licensed professional develop the plan. We have a licensed professional who can deliver the plan. And then who do we contact next?
The family takes the proposal for a treatment program to the state Medicaid agency's EPSDT office. They show the plan to the office and say, I want this plan funded here, just like it was funded in all these cases in Pennsylvania. And at that point, the state will say, we don't do that here. But that's when the psychologist or whomever you have as a licensed professional steps up and says, well, wait a minute, we actually do that here. I'm doing it, and I'd like to get this funded. If the family still gets a no, we won't do that here, now they file a civil rights complaint, and I believe that it will be amazing how quickly that story turns around.
Well, this is, Steve, I have to tell you, this is This has been a super show because you've taken folks step by step and given them your years of experience and problem solving as to exactly what to do to get the services that their child needs. And I hope, folks, that if you haven't written it down, I want to make sure that you do before we close out. So, Steve, give us one more time the contact information so folks can get in touch with you.
The best place to go is the website of the Institute for Behavior Change, www.ibc, that is Indigo Baker Charlie, hyphen like a minus sign, P as in Paul, A as in Apple, .org.
Well, this is super. And, folks, today's guest has provided us with, I think, some information that can change the delivery of services for children needing behavioral treatment throughout the country. So we are very grateful for your time, Steve. And anything else you'd like to leave our listeners with before we close out for the day?
I'd like to thank you, Andy, for giving me this opportunity to tell people what the truth is and what's possible. I have a great deal of admiration for all that you've done in that regard, and I'm thankful for the opportunity to be on your show.
Well, thank you, Steve. And folks, again, Steve is going to be coming out with a book that will even explain further all the good things that he's doing and how it's happened and what you can get. And I'm looking forward to working with him in doing that. And so it's very exciting, and we thank you for being with us, Steve.
All right, take care and thank you.